Welcome back. Now, Gift of the Givers is making progress in drilling boreholes in the Nelson Mandela Bay. The metro is currently facing day zero, and the non-profit organization has intervened. It started drilling the first borehole on Monday. Founder and chairperson Dr. NMB Suleiman joins us now live from Gqeberha for an update. Dr. Suleiman, always a pleasure talking to you. Thank you so much for giving us your time this evening. The latest in terms of, an update on how you're doing with the drilling of boreholes in the Nelson Mandela Bay. How are you doing so far?
Good evening, Tuelo. It's going very, very well. The first borehole yielded just over 2,000 liters per hour in the school. It seems like very good water. And whilst we were doing that, whilst the drillers were busy, we then looked at another site within the same school. Because what we're trying to do is to help the school children, both for drinking as well as for sanitation. All the principals, all the teachers are worried about sanitation in all the schools. It's going to be a major problem. If there's no water, kids can't go to school. It's going to be a health risk. So the aim is to support the school with what I've said, and also support their families. So if it's possible, the children can take water in 5-liter containers back home. And at the same, because all of them are not from outside the school area. Some of them come from far. They said in some areas, they come with buses and kumis from a big distance. And then there are communities around the school. And the particular school, Alpha Primary School, where we are drilling, there's a huge community right around the school. And it's quite a big area. So when we started drilling in another point on the other side of the school, so it's accessible to very poor communities in the area. So that's the second ball. Whilst we did that, we went and looked at another school called Malaba Primary School. Around that school, again, there's 1,100 children come from various areas, same issue, what will happen about sanitation in the school. And there's a lot of informal settlements around those schools. Now, we're trying to get to people, who can't afford to buy bottled water, who won't be able to take transport to go to school, may have difficulty, who may not have children at school, and they still need bottled water. So that's the second school. And then the other one is the TB hospital. There's 237 patients there, 160 staff, almost 400 people. And that's TB CEO, hospital CEO, Jose Pearson Hospital, called very worried what's going to happen to the patients and the staff. Same policy, we're citing it. Tomorrow we're doing something on site. The hydrologist will be there. We went and visited all the sites already today.
Right.
And from there, again, they can take it and go home. And then something interesting happened. It's something that we're working on, where we spoke to the municipality. I had all the technical staff and engineers with me yesterday morning, where I'm in P, and they joined us. And we're asking for a list of all boreholes that were drilled but were not utilized. And we've got those points, and we're going to be visiting to see which is the most practical one to open up, just put the pumps in, and then instantly you got water. And whilst doing that, we got a call from the K9 unit, from the police unit to say what's going to happen to the dogs. There's no water for them to drink. But they got a borehole on site. So tomorrow morning, it makes life easy. We're setting a special team there to look at that borehole, to see if we can open it, and then put pipelines for the SAPS itself, for the dog unit, for the dogs, and for all the houses outside that unit.
Perhaps, Doc, describe for us, with all the work that you're doing within the municipality, how dire the situation is there. We talk of day zero quite frequently, but I mean, if you're not within the area, you're not experiencing the water shortage, perhaps you may not be able to understand exactly what community members are going through. With the work you're doing, then what you've seen, how dire is the situation?
Some areas are already at day zero. It's not. It's when you have no water every single day. One of the areas in the place called you can take Kwanobushwe, 2 wards they haven't had water for 4 months. So I asked them, you mean every second day for 4 months, every 3 days, third day for 4 months? They said no, 4 months, no water. And then the other areas where 2 weeks there's no water, and more as I speak to people every day, they said the water levels are decreasing. It's less frequent. It takes a longer time to come back. It doesn't last for too long. It's inconsistent. The hospital hasn't had water. Schools haven't had water. Communities haven't had water for 7 days. And of course, the municipality have said it clearly. I mean, they've been saying at some point they're going to shut the water off, in many areas. But whilst doing that, they're preparing the sites. They're putting taps outside on the road for people to collect water from those taps. So it's very difficult. People can't wash, they can't drink, they can't take medication. It's just that if you're not living here, you won't know. And even if you're living here, if you drive past, everything looks very normal. You get off the airport, nothing looks like there's some major emergency. It's not like a flood or an earthquake or, the disaster in the KZN that you can see things destroyed. You can't see anything. So you think everything is fine, but it's not. The people are very quiet. When you speak to them, they just say very passively, we haven't had water for 7 days. We don't know where to drink, what to do. Situation is very dire. What must we do? It's very passively people sit here. And the moment they see you doing something, their eyes brighten up. They say you give us hope. They feel motivated. And whoever is trying to help them, they are really, really grateful.
Yeah. And just in the last question I have for you, Doc, I mean, months without water, what more still needs to be done? And how long do you think it would take? I can imagine, and I just wonder if they have patience for another 4 months without water. How much more work still lies ahead?
Oh, there's a lot of work. It can be speeded up. It all depends on funding. If there's lots of funding, well, you have to look at it this way. Either you get water from the dams, and the water there is water in the Harib Dam, which is supplying the Noit Khadak Dam. But from there to the rest of the city, there's a bit of a problem. There's water leaking. There's water leaks of 80 million liters a day. And some of the areas have to be supplied by other dams which are running low. So that's the first problem. There's no source, there's no rain, so there's no water from rain. To me, the best option is groundwater, and we need to drill as many places as possible, as fast as possible. We do have some time in terms of the red areas. There are red areas which need water immediately. You can respond to those quickly, and then you have a few more days to play with for the other areas that may get affected in the next 2 to 3 weeks. Well, the City Council is trying very hard, sending water tankers out, and we're going to support them and to put more water tankers, and we will support them with JoJo tanks, because if you stand with a water tank in one area, you're losing time. It takes quite some time for people to collect water, but you empty it quickly into a JoJo tank, you go back and fetch more water, and the advantage of that is somebody who missed a tanker doesn't get water at all then. But if you put it in a JoJo tank in the area, whether they come in the morning, afternoon, evening, the water is there. So it needs more JoJo tanks, more water, drilling all over. And that's why these boreholes that have been drilled some time ago, they're vital. Even when they give 10,000 liters a day or 20,000 liters a day, it means people will get water instantly. So that's the way to go forward. Although the municipality, I must say, is looking at different options to release about 30 million liters a day extra from the Borehole Dam. They want to move the barge, and there's some project engineering thing they're doing there, and also in another area where they think they can increase water supply to the dam. So they're trying very hard. The civil servants, the engineers, technicians are trying hard. And the last point is the business sector is now sending out teams to start repairing leaks. So they try to save as much of that 80 million liters of water that's being lost today.
Oh, I appreciate you speaking to us and giving us this update. Dr. NMB Suleiman, founder of Gift of the Givers. We know a lot of work that they're doing out in the Nelson Mandela Bay, of course, drilling boreholes at this point, ensuring the community members, especially children, going to school, needing that water. Some, of course, saying they haven't had water for months now, 4 months to be exact, and much relief, of course, needed in those areas.